Hi, Julia. Welcome to my show. How are you doing today?
Hi Ella, I'm doing really well, thank you. Thank you for having me here today.
No problem. Please, can you tell us, Julia, who you are and what is it that you do?
So I work in private practice as an arts psychotherapist and clinical supervisor. So I trained and completed a master's in drama therapy, and that comes under the umbrella of arts psychotherapies, along with music, dance movement, those sorts of
Mm-hmm.
disciplines. As a supervisor, I support other practitioners, so therapists, and also organisations, perinatal services.
Right.
I work for an educational service providing supervision for head teachers and senior leadership teams as well. And on top of that, I'm also a mum to two young boys, which keeps me probably busier than all of the above.
Sure. And who are your main clients?
So my main clients are women, are mothers, and also mothers to be. I do quite a lot of perinatal work in my
Right.
practice.
Okay. And how did you ended up working in this wonderful area that helps so many people?
Thank you. Well, I originally trained as an actress, so I've always been about drama. That's always been my thing. And
I think
a lot
many
of
of
people,
us are about drama these
I was
days,
going to say, a lot of
of
people might
course.
say that's very dramatic. I am quite dramatic. And I saw a leaflet basically about a short course in drama therapy. And I
Mm-hmm.
was really curious because I had thought about counselling, but I didn't realise there was a way of combining the drama and the counselling. So I did this short course, which actually was the sort of precursor to the training that I ended up doing. And it was, yeah, it was fantastic. But I still had my actress ambitions. So I went away and did that. And then I came back and then I retrained and did my master's at the University of London. And that was in
Right.
2009. So it's been,
Right.
I'm not going to count the years, but it's been a little while.
No worries. So currently you're working as a clinical supervisor and psychotherapist in
Yes.
London,
Yeah.
and you helping women who struggle with anxiety, depression, um, and generally struggling adjusting to motherhood,
Yeah,
as well
adjusting to
as you helping
motherhood.
moms to be prepare them for this journey,
Yeah,
right?
so there can be anxiety in pregnancy. It might be, dealing with miscarriage.
Right.
Also, I do quite a lot of work with birth trauma as
Okay,
well.
yes, trauma as well, of course. And based on your experience, what are we yet to learn about the way we need to look after ourselves,
Mhm.
especially us women?
Yeah, I think I think we need to really learn about how much of what we experience impacts on and is also held by the body. So, for
Okay.
example, I will ask pretty much all my clients, right, when they're talking about a particular emotion or experience, what's happening in their body in that moment? Are there any tensions anywhere? Could be around the shoulders and not in the stomach. What does their breathing feel like? Because quite often the breath will come here or even here, which
Mm,
can feel very oppressive. And I do a lot of work, as I said, with trauma. I do a lot of work with childhood trauma, and I
okay.
often talk to my clients about the idea of explicit and implicit memories. So explicit memories are kind of from the time where you were verbal, where you spoke, where you were kind of more conscious of your world.
Yeah.
Um, and in his book, David Walling talks about his book Attachment and Psychotherapy, which is an excellent book. He
Mm,
calls it the knowing that.
okay.
And then he talks about implicit memories, which are from the kind of, pre-verbal time, even in the womb, which I find quite incredible.
Yeah.
Um, these are the implicit
Children.
memories, and he calls them the knowing how. And he gives an example of like riding a bike. You don't sort of consciously think about how you ride a bike. Your body, it knows how. It has that
Mm-hmm.
implicit memory of riding the bike. So I think, we need to look after ourselves holistically as a complete whole, so
Yeah.
body and mind, if we want to improve our mental health, and particularly around parenting, motherhood. We often, the majority of my clients are often guilty of kind of putting others' needs first,
Yeah, of course. Yeah.
rather than their own.
Yeah.
I would say.
Very common thing among women. And it's a shame that many of us, including myself in the past, only come to realize that when they totally neglect themselves and the connection they have with themselves, their spiritual connection and the connection with self. right?
Absolutely. And I think, you know, for me, I'm very much about encouraging people to take action kind of before crisis point as well. You know, that thing of like when you're starting to feel low or starting to feel like, you know, that's the time to, you know, as I said, to pay that attention to what's
Exactly.
happening to you in your body, and, you know, and give it the attention.
Yeah, and it seems to me like this is yet again going back to self-awareness, isn't it?
Yes.
This
Yeah.
self-awareness really is the seems to me like the foundation of everything, of healthy relationships, of
Hmm.
mental well-being, of physical well-being, is paying attention to your body, paying
Hmm.
attention to how you feel, understanding, trying to understand what might be the reason you feel like that.
Hmm.
And even if you don't fully understand that, because very often, like you said, it might be related to childhood trauma or
Yeah.
very early memories,
Yes.
not neglecting that,
Hmm.
ignoring those feelings.
Yes.
So
Yeah.
not ignoring how you feel and not ignoring being low for a long time,
Absolutely.
or feeling depressed or feeling anxious or having problems breathing, just
Hmm.
paying attention to our body. And this is super interesting actually, because I'm currently listening to the audiobook, When Body Says No by Dr. Gabor Mate. And the book is a fantastic collection of stories of patients who suffered from autoimmune diseases as well as cancer.
Hmm.
And it's a book written based on evidence on those cases, on Gabor's Mate personal practice and his work. And excuse me, and it refers to the fact that exactly what you said, we need to look after ourselves holistically. So
Hmm.
whenever we experience discomfort or pain in our body, whether we are man or a woman,
Absolutely.
we need to connect that to our living conditions, to our current relationships, to our
Hmm.
previous relationships, in order to further prevent the development of the disease.
Yeah,
Because
definitely.
if we are unaware what might have caused, and very often we are unaware what have
Hmm.
caused an illness, um, doctors are telling us one thing, but many doctors these days in traditional medicine do not have the holistic approach to
Hmm.
healing people, but very traditional approach, right? So
Yeah.
it is our job as moms, as dads, as adults, even when we're not parents, to pay attention to our body, to um, to reconnect with ourselves, and
Hmm.
really learn how to have your own back in a way.
Yeah. I'd
I
say
call
it's
it
also trust. You've got to trust
trust yourself,
that
right?
voice inside you, right? That's
Exactly.
not ignore it and say, oh, okay, I'll think about that later, or, you know, and, you know, I often say this, you know, again, to, you know, to all my clients, you know,
Yeah,
you're the expert on yourselves. You know your body better than anyone.
that's
And, you
right.
know, the minute something is not feeling okay, you know, don't ignore, you know, trust that. Don't ignore that voice in
Mm,
you, you know,
mm.
that, as I said, that's needing that attention, right? That's trying to get your attention. Um,
Yeah, absolutely. So I suppose self-awareness is one way
mhm.
to start approaching whatever is that we struggle with, building
Yeah.
that self-awareness. But how else do you feel, or do you think we can initiate this positive changes in our life?
So for me, you know, the positive start is something like therapy. And I know I'll say this as a therapist, okay, but, you know, essentially therapy is time for oneself to
Mm,
focus on oneself. And if you want to make those positive changes, you know, it takes commitment and it takes time. And that commitment can be shorter term or like, you know, I've had clients I've worked with for 3 months and or some for 3 years. So that's very much
yeah.
unique to the client, but it does take that commitment. And I think parents and particularly mums can struggle with guilt about that idea of
Mm,
taking that time out on a regular basis for themselves. But
exactly. Yeah.
you know, I can talk a bit more about that. But I think thinking about what we're talking about with the idea of the holistic approach, the therapy space for me, certainly in my work as a drama therapist with my clients, is it gives you that opportunity to sort of lean into those nuances in your body. So the things that I was talking about, you know, so thinking about what they're trying to say, what they're trying to communicate to you, because there's just so much else going on in life. And as I say, people, you know, it's like, oh, I think I feel that, but oh, do you know what? I've got so much to do. So the therapy space to me is such an important one, because
Yes,
it
it needs to
really
be
is time to
protected,
focus on
right?
yourself, and it really does need to be protected. Definitely,
Yeah,
definitely.
yeah.
And I was
Can I
thinking
just
about
mention one thing? I read
yeah, of
somewhere
course.
something really that I remembered, and something I try to use in my own life is emotions are our body's feedback system. And I mean, this is not the official definition by anybody famous. I read it somewhere, or in a couple of places actually, and it just makes sense if you think about it. The emotions we feel related to who we are, about our life, about our motherhood, whatever, our childhood,
Yeah.
are a feedback, and whatever we feel in one given moment is our body's feedback system of letting us know whether we should continue doing something or whether we should avoid that person or that situation.
Absolutely.
And it's that
Absolutely.
feedback system that our body gives us. And I think women in general are quite intuitive,
Yeah.
and that's good. But we should really practice self-care and not ignoring our, like you said, our inner voice
Yeah.
and
Because I
our
think
body.
that mechanism is there to protect, right? It's to protect our
100%.
young, okay,
Yeah.
our children, but also, you know, it is needed for ourselves, you know, and you know, the majority of my clients, they're so depleted, you know,
Yeah.
where they've just given and given,
Mm.
and they haven't resourced themselves. And this whole idea of the giving as a mother, I mean, that's a whole other sort of podcast. We could talk about those
Yeah,
reasons why,
exactly.
okay, but
Yeah. Yeah.
and that's why I come back to what I said earlier about, you know, kind of when you hear that, you know, get the support and pay attention to it before it becomes a crisis,
Yeah.
you know, kind of
Because also, and you must do that, because what you don't think about at the time is how that is affecting your children
absolutely,
without you even realizing it,
absolutely. And
which
that's
is
the
the
thing.
core of the problem with today's crisis in children's mental health. It's the fact that not just mothers, but the people who raise children, who are actively involved in raising kids, the key, what do you call them, the key adult, or
Yeah, so caregiver, it would
that's
be,
it, the
so yeah.
caregivers. They including grandmas, grandpas, uncles, moms, dads, brothers and sisters, but mainly the closest adults, the parents. Whenever we struggle from stress, anxiety, depression, frustration, perhaps related to our work or poor work-life balance, we will take it out on our kids in one way or another, unless we learn how to offload those emotions and those frustrations in a different way.
Yeah, I absolutely echo that. And I think there's a couple of things here. So firstly, I think you're modeling for your children self-care, right? If they see you taking care of yourself and knowing it's okay to prioritize your needs sometimes, you know, and knowing when that needs to happen, that
Yes.
is a really good thing to be showing your kids. And secondly, I absolutely hear what you say. There is definitely something about the impact. So in therapy, we talk about the ripple effect. Okay,
Yeah.
so you know, if you imagine like a stone dropping in a pond and all the ripples emanating.
Yes.
So the idea is that, you know, with certainly with the majority of the clients I work with who are mothers or parents, you know, if you are getting that support for yourself, it's only then, you know, if you can start to make those positive changes, it's only going to have a positive impact on those closest to
That's
you, as you
right.
say, for example, your children. And
That's
I
right.
worked for many years with children and young people, and but the parents just didn't have the support, and it's just so important. And I as a result, I've worked with a lot of parents, many parents who, you know, have relationship difficulties with their children, but in getting that support for themselves, making those changes, you know, then the impact it has in a positive way on those relationships is wonderful. and it's absolutely doable.
And I think in simple terms, the sooner we reach out for help, as moms or dads, the sooner we will prevent poor mental health in our kids.
Absolutely.
And unfortunately, and I hate to mention it, also plenty of different types of diseases in adult life, which very often originate from lack of, parent who has been emotionally unavailable, or parent who wasn't there when they needed to be there, or mom who was totally absent-minded and mostly frustrated with her life. This is all causing our children illness in adult life, among other factors, of course. But
if you get that support as a parent, I work with a lot of parents whose children are struggling with their mental health in a big way, but in getting the support for themselves, they're able to better support their child.
100%,
and they also have a place where they can come and offload, so it's not playing out in the relationship with the child. They're able to come and let off steam and think things through in the therapy space of their own, and then they're in a much better position to support their child in their healing journey.
Yes. So let's talk about your clients for a minute. So we've mentioned at the beginning of our conversation that you mostly work with women, but you also work with children. With regards to women being your main clients and mothers, what are the most common issues women come to you with? What are the most common struggles?
I think the most common is anxiety is huge, and I know we've touched a bit on this at the moment. There's a huge amount of anxiety around, and shame is another thing. I think working with trauma, often there's a lot of shame around, particularly around childhood trauma, and there's also relationship issues, as we touched on, with children, with partners.
Or would you say that anxiety is the leading the most alarming, the biggest?
That tends to be linked. So sort of a lot of the perinatal work I do, a lot of it is linked to anxieties about, different areas of pregnancy or early motherhood or relationships with children. It's that heightened level of anxiety that often brings clients, I would say.
Right. And what do you advise them in general? Like, how do you help them? How do you lead them through the journey to improvement? Let's say they have high anxiety and a feeling of guilt that is associated to not being good enough mother. What do you do to help them?
I think firstly it is just giving people a space to unload. I mean, I know that sounds really kind of like, well, you could do that with a friend, you could do that with a partner, but it's really not the same.
It's not the same at all. No.
And it is interesting in working with the body, because obviously, a lot of people will say, oh, I don't work with the body, I don't know what that means. And it's like, but you do it all the time, without even kind of thinking about it. So I'm always making those observations to start with as well. But very much making a virtue of the fact that the therapy space is their own, to be how they want. If they want to come and, be upset. If they want to come and, tell me stories about whatever, it's perfectly fine. And I think the first few sessions often are a bit like that. But I think this is then where the body work comes in and is really useful for helping people find techniques to calm. So there's a technique I use a lot with anxiety called the 5, 4, 3, 2, 1. It's very popular with therapists.
Okay.
I do it a lot myself. So it's using the 5 senses. So it's the hearing, the seeing, the touch, the taste, the smell. And you can do it sort of anywhere. It's really, really easy. And it just helps people to recenter. So little techniques like that could be for anxiety. And I think it's just that there really is something in the sharing, the knowing you're not alone, the connecting to somebody, because a lot of people will carry these anxieties on their own and they feel like they're the only one, especially mums. They think, oh my God, everyone else is coping, they're going to work, their house is always immaculate,
exactly.
And so I think just knowing that they're not alone, and in that sense,
and removing the fear of judgment,
the fear of judgment,
which
and
is, I'm sure you established that in the first session already.
I have this a lot because moms will say, oh, what must you think of me? You must think I'm a bad parent. And I I honestly just think that as a parent, it's like being human. Okay, yes, there are times where you're on it and everything is as you want it to be, but there are times where it's going to be messy and it's just going to feel really uncomfortable, and that's everybody, including me, as a parent. So, but that really is something I'm very sensitive of. Absolutely.
And I think women who perhaps ask, and it's a natural question to ask a therapist or even a friend, it's natural that they worry about that because you don't know them. And so they are scared and afraid they might be judged, right? Even by their own therapist. But when they're asking that question, I would imagine many women are forgetting that this is a place to help you so we can help your children.
Absolutely.
So
yeah,
you are here to help yourself in order to help your children, your partner, and your husband. Because don't forget, this is a circle, and it's transferring. Unfortunately, mental health travel in families, and your anxiety will transfer, like we said, on your children, on your partner, and it will negatively affect the quality of your relationship with your partner.
And it goes on because a lot of my
That's right.
clients work with what I call generational trauma. So things passed down from parents, from grandparents, from, and so as you say, these things inevitably, will have can have an impact. So absolutely, in giving that help to yourself, as I talked about, that idea of the ripple effect is a very, very powerful thing.
What are the most powerful techniques or approaches that you have used across the years of your practice that you feel are really helping women? And this doesn't have to be a rocket science, but what did you find that really works in therapy?
So I guess it's got to be the creative work, and that's really what sets my work apart, I think, from a lot of talking therapists. Although obviously people, are welcome to talk in the therapy space. Certainly the movement work. I think a lot of us can feel quite awkward in our bodies and a bit unsure, but I have just seen such transformations when people feel relaxed enough, and it can take some time. I wouldn't expect somebody to come in a first session and feel that, it takes time to build the therapeutic relationship and to feel comfortable, but just the weight that goes from people, you can almost see it. It's a real privilege. Those are moments where I just feel so privileged in what I do. So the movement work, it can be very transformative. And I also do a lot of work with images. I've got some stuff behind me like postcards, image cards, or people making their own images. And just to stress, any kind of creative work, you don't need to be an artist, you don't need to be a dancer. It's not about that. It's about what you produce. And the thing with the creative work is it often unlocks things that are a lot deeper, or what we would say perhaps more subconscious, right? When you're talking, it's all up here and you're like, oh, I did this today, but the creative stuff, it taps into the stuff that's really deep inside. And it can really, really be powerful. So people will choose an image and say, oh, that looks nice. And then you look at it a bit more. What about the shapes? What about the colors? What about the character? And it is, it's always then related to something that is going on a lot more deeply, but it feels easier to talk about because you're talking about that image, right? And then at the end of the session, that image will be put away. So
which is why your work is such a successful way of approaching therapy and drama therapy, is because it reconnects us with body and reconnects us with movement and images.
Absolutely.
And I feel the importance of that is huge, because whoever suffers from anxiety or depression, and that's many people these days across different age groups, these people are often forgetting that they're absolutely not realizing that they spend too much of their life in their head, right? And they need to put it quite frankly, or to get out of their head and get into their body. So we need to think less and move more. And that movement in terms of people who have anxiety and depression is really healing, right? Because the trapped emotions, the sadness, the trauma is coming out of our body. So talking about problems is just one way of solving them
Yeah.
But moving your body, dancing, drawing, writing, any creative work, painting, can really release tones and tones of trapped emotions from perhaps years ago. So I think we all need to listen to our bodies a bit more for the sake of our mental health. This has been super interesting conversation, Julia. Thank you so much for being here today. Any final bit of advice for our listeners and our viewers?
There's a couple of things. I'm all about manageability. I don't like to overwhelm people, so I'm just going to say a couple of things.
Sure.
Firstly, I do want people to really remember what I said about the ripple effect. Okay, looking after yourself means essentially looking after those around you. So please, make that a priority. And secondly, I wanted to also give people some homework, because the inner teacher in me likes to do that sometimes.
Very good. I love that.
When we talked about that idea of going to the past, and that I do that quite a lot with the trauma work that I work with, I think people often associate it with sadness, and there is sadness around, but also what surprises a lot of my clients is reconnecting with joyful things in the past that have been forgotten. And again, this happens a lot as a parent. You put all the stuff you loved doing or exploring to one side. I do this myself as a mum. If I don't do something creative, I really feel that in my body. So I would want to encourage listeners and viewers to, in the next week, rediscover just one thing that's been a bit forgotten or to the wayside that you really loved, and just kind of see what it sparks in that moment, that rediscovery.
Yeah, perfect. Thank you so much. For any of you who is interested in Julia booking a session with her or her work, I will attach the link to her profile in the show notes. And thank you for now. I love this, and I hope this is helpful for all of you. Thank you, Julia.
Thank you, Ella.